Hi, my name is Heather Donley, and I'm the Executive Director of Assisted Home Health and Hospice Foundation. It is my privilege to introduce to you the Joyce Travers Palliative and Hospice Care Education Grant. This grant is a representation of Joyce's life and how her love of people and hospice care helped inspire all of those around her and gave relief to all those she cared for.
Joyce looked beyond the picture and looked at them as a human being rather than like a patient. And so I was very new at this. I never dealt with anybody dying, and Joyce taught me how to realize that is somebody's grandparent, that is somebody's mother, that is somebody's sister.
I could really just express how incredible she was. She was just above and beyond, in my mind, what a mother could ever be. When times were great, she was awesome, which is as expected. But when times weren't, she never, had me or my brother worrying about things. She always took care of us. She was as strong of a woman as I could ever have as a role model, that I could ever hope that a future daughter or wife or anything could be. And I think that if I could somehow translate that into anybody that I touch, that would be pretty incredible. And I think that a lot of people that have met her could probably say exactly the same thing. She was just a really incredible woman.
The purpose of palliative and hospice nursing is to treat not just the disease, but the person as a whole. It involves enhancing their quality of life and providing necessary support so that that patient can continue to live the life to its fullest extent for as long as that may be.
She wanted nothing but to be a hospice nurse. That was all she wanted to do. And it allowed her to fulfill her passion, right? She loved this job. She loved what she could do for people and making an impact. But really it was about taking control of her life and doing something that she wanted to do. It's one of those rare opportunities where you actually get paid to do what you love to do.
She thrived. She did really well taking care of hospice patients, which is not as easy as it is for some people. For other people who have that gift, which she had, she could change their lives.
She took the initiative to move patients outside any time she could. She'd open the doors, let them feel the air, the sun on their skin, look at a hummingbird, whatever it was. She understood how important that was to the individual. And if you have that ability to really care, you're headed in the right direction. If you have that type of heart that will enable you to do that for people, I really, really encourage you to pursue that.
There was this one woman that we cared for in the valley, and her name was Joy. And Joyce was going to see Joy that day, and she said, well, I have to go because I have to go pick a Dodger dog for Joy. And I said, what? And she's like, I need to go bring her a Dodger dog. She wants a Dodger dog. And I was like, wow, she likes Dodger dogs? She goes, she loves them, and I know this place, and I'm going to go down to the valley, I'm going to go pick them up, and we're going to go have a Dodger dog. And I was so, wow, you're amazing. And this woman enjoyed that Dodger dog, and I think they had a few more, and that's all she talked about for months.
She just decided to pursue her passion. Clearly she had a passion for caring for people. She had also cared for a friend, I believe, who had breast cancer, who passed away, and she cared for that person all the way through. She's done this. She knew how to do it. She jumped in. She figured out how to get to school, how to manage this, how to financially afford it, she still had boys at home, working and trying to hike. And somehow she navigated it all. And one of the things I remember her sharing with me is that she didn't want to just pass. She wanted to show these younger students that, boy, I'm coming in here twice your age. If I can do this and do it well, you can too.
The Joyce Travers Palliative and Hospice Care Education Grant is a legacy for future LVNs and RNs interested in getting certified in palliative or hospice care. The grant requires all applicants be licensed nurses and have worked in the field of nursing for at least 2 years. If you are a nurse interested in becoming part of a palliative or hospice team, please submit a request to foundation@assistedone.com or contact the Foundation office at 805-379-3656. Please help us remember Joyce by giving the next generation of inspiring nurses the opportunity to become certified in the field of palliative or hospice care.